to strengthen India and US relationship. Also, the healthcare diplomacy is also part of that. And AAPI is going to do a global health summit, which we will talk more. But I want you to say a few words about the healthcare diplomacy, India US relationship, whichever you feel like. Thank you so much.
Thank you, Dr. Katula. Other distinguished members of AAPI, friends from media, a real pleasure to be here. I was present in the AAPI event at the Marriott when we were celebrating that, I guess, 2 months back. And there I mentioned that my first association with AAPI was way back in 2005 when AAPI came to Moscow for their convention. And I was there joining one of my senior colleagues from Foreign Service, who was a graduate from All India Institute of Medical Science. He passed away 2 months back. He was our ambassador in Turkey, Dr. Birender Paul. So he took me to the AAPI convention in Moscow. And I didn't know much about that, but then I remember after the event, I came back with an impression that here is an Indian organization, which is very powerful in terms of the great work it is doing in the American society. So you could feel that, even when I was in Moscow without being familiar with the lay of land here, I developed a sense that this community is making an impact in the mainstream United States. And when I came here in January of this year, I attended quite a few events, whether under the banner of AAPI or in other places where I met, very distinguished members. Like, we have been meeting like, Dr. Parikh or quite a few people, from your association that we meet in one form or other. And we see the impactful work they are doing in the society. Of course, I'm familiar with the statistics that, 10% doctors of this country are, Indian origin, and they are treating about 30% of the patients. And so, that statistics is not only well known here in this country, it's very well known everywhere. But I would say much beyond that, the impact of Indian Doctors Association, the impact of Indian presence in the healthcare sector in this country, whether it is the doctors, whether it is a pharmaceutical industry, it is very, very well found. My expectation, my request has been that, this is time to rethink about how you do the contribution back home in India. I know all of you do individually and collectively a lot of good work back home in India. But India is changing, the economy of India is undergoing a massive transformation. The Indian people now probably don't require their basic needs to be touched. They would expect a strong association like yours to help them to touch their aspiration, not the daily needs. So I would request that, people like you who have access to the best of the medical technologies, people who have access to the best of the elite society in this country, and to the not only the technological but also financial resources, can think about what you can do to touch the aspirations of people, to use technology to reach to a much larger number in India. I would conclude with that, but thank you for inviting me for this occasion. I know this is your annual retreat where you are supposed to, kind of have a good time among yourself. I was present in the last session where I saw people discussing very interesting thing about, what has inspired them the most. And I was listening to somebody mentioning about his mother. Somebody was mentioning about, how the 3 children were, taken care of by the family. So I was finding it a very interesting conversation here. So all the very best for your leadership summit, and thank you for inviting me here.
AAPI is like, it can be a bridge between India and US, and we are doing many things during COVID time. We did raise about $5.2 million, which was sent to India during that time. And we helped with oxygen concentrators and ventilators. And Dr. Jagdish Gupta helped us, actually at that time to find a company. To find a company at that time was so difficult. And we were scrambling to find somebody who is reliable, who can actually deliver the equipment in time to save lives. So we were actually meeting like 3 to 4 times a week to really buy the equipment, who is reliable. If we send the money to India, who is going to deliver? I mean, is it reliable or not? So Dr. Jagdish Gupta was there at that time, and he suggested a company, and we went with that, and then Philips and other companies. So it was a time where India needed help, and we were glad to do that through AAPI. And not only that, we have done some programs like Adopt a Village, where we screened for chronic diseases, including diabetes, hypertension, hypercholesterolemia, chronic kidney disease, anemia, malnutrition, all these things we have done in 75 villages. We have screened close to 10,000 people. And we actually presented that to Honorable Ambassador at that time, Taranjit Singh Sandhuji. So yeah, these are the things that we have done, and there is a lot more to be done. What are we doing for our homeland, the motherland that gave us so much? I mean, I was educated for free and not paying a penny. Most of us are actually. So, and what can we do to India? So that's what we always really think about. And this time we are organizing a global health summit in Delhi, which is going to be held in Le Méridien Hotel from October 19th to 20th. It's less than a month from now. So in that, our theme is to prevent cancers, because that's going to be very rampant in India. And we are seeing so many breast cancers, so many cervical cancers, which are very treatable and preventable. But we are not able to screen that many people because there is no awareness. So there is no healthcare, there is sick care in India, because only when the people are sick, they go to a doctor or a hospital. But how do we really stress on preventive care? So this summit is going to be all about that. How can we reduce the incidence of cancers, and how can we reduce the heart attacks? Because heart attacks are so common in younger people. I mean, we are reading in the news that people are going for this military or police training, and when they're going for a few hundred meters, they are collapsing and dying because of underlying coronary artery disease without knowing what they have. So how do we screen those diseases, and how can we prevent? So we put up a panel together actually to come up with some solutions in low resource countries like in India. India is not a low resource country anymore, but still the awareness, how can we really educate people? And again, we need media help with that. So how can we really get that message across in India? So how, for example, let me give you one statistic. I'm a cancer specialist. The uptake of mammograms in this country is about 90%. 90% of the women who are eligible to get mammograms do get mammograms. And we actually screen for breast cancer with mammograms, and we can prevent it early stage. And if there's a small lump or a precancerous lesion, we take it out, and that is cured. Whereas in India, people come with advanced disease because there is no screening there. And the uptake there is only 1%. If you take 100 people, only one person gets the screening mammogram done. So it is really a staggering statistic. Same thing with pap smears. Pap smears are 70 to 80% compliance rate here, whereas in India it's only 3%. So that is really, really low. So how can we improve these things? And then the technology. How can we really include the technology in preventing diseases, especially cancer and heart attacks, which are one of the more common causes of death? So technology like eye breast exam, which is like a small device, handheld device. Mammogram machine costs so much money. It is not mobile. It can be if it is a big truck or something, but this is a handheld device. People can take it anywhere. Even a healthcare worker can actually screen with that device with accuracy, 90% accuracy. So those are the things we want to implement there in India, artificial intelligence and things like that. So these are all the things that we can do. And that's the summit is all about. And we are going to meet Health Minister and hopefully Prime Minister Modi ji, and then even President Draupadi Murmu ji. So we are trying. So if we meet them, we'll get the message to them. They know that, but at least if it comes from people like for cancer specialists or cardiologists, I think that will have more impact, hopefully. So that's what we are doing in India. And then when it comes to US, we have 3 or 4 projects going right now. Bone marrow or stem cell donation. So Southeast Asians, Indians especially, have match rate. If somebody gets leukemia or lymphoma, if they have to get stem cell transplant, the rate, the chance of finding a match is only 0.03%. 0.03%. As opposed to a Caucasian, which is 20%. They have 20% chance of matching a stem cell donor but in Indian population, it's 0.03%. So how can we increase the pool of those donors? There's something called NMDP, National Marrow Donation Program. So we are trying to recruit people going to Indian events, and then they have to be between 18 and 40 years of age to be eligible to donate their stem cells. And there is also a myth that it is bone marrow, and we have to really get into the bone marrow and draw the bone marrow, which is completely not true, which was the case when I started my fellowship 25 years ago. Not anymore. We can collect stem cells. Simply, we need an IV line. There is a machine which collects all the stem cells. It's as simple as that. So it's very easy. So we have to really educate people to donate, to increase the pool, to make a difference, and to save some lives. So it's just a buccal mucosal sample. You just send a cheek swab, and they actually have the DNA and all that, and they can really match. That's all you have to do. If there is a need, that's when they call you actually to ask you for your stem cells, which is also a very simple procedure, as I mentioned. It's a very simple one. So the second thing we are doing is how to prevent heart attacks in Indian diaspora here. Because as I mentioned, not only in India, Indians in America are also very prone to develop heart attacks. And how can we really prevent them? And there is people are not aware of screening tests like calcium score. Dr. Shukla is a cardiologist, he knows, and he sees them all the time. So how can we really do screening tests like CT angiogram or CT calcium score to prevent heart disease early on? So I have seen my friends dying in their 30s and 40s, which is really sad. So that is the second project we want to embark on. And the third one is Million Miles of Gratitude. Million Miles of Gratitude. This is for veterans in this country who sacrifice so much, that is to give back to the society we are living in. And million miles is each mile everyone walks. If you can log in, that is like a tribute to a veteran. So we want to collect million miles. There are two things in this. Number one, honoring the veterans. Number two, increasing physical activity. Physical activity is so important in life. It is a risk factor for cancer. It is a risk factor for stroke. It is a risk factor for heart attack. So all these things, sedentary lifestyle not only increases the chance of getting all these diseases, it is also an independent risk factor for increased mortality. Those people, they may not get heart attack, they may not get cancer, but they die because of sedentary life, which is very, very true, and it is proven in studies. So that's why we want to encourage people to be physically active, at least 20 to 30 minutes a day. So if they can walk and log in their miles, that stimulates them to really do this. And physicians are very well aware of that, but non-physician community is not well aware of that. So we want to get that message across in the community for them to be more active and eat right and those things. So those are the things that we are doing. And we need media help to get this these programs into the general public so that they can really get benefited from this. So, and anything you want to say, Hethel, Board of Trustees of AAPI, and she's the host of tonight's, this leadership retreat, and she's the one who put together all the speakers, wonderful speakers. We thank them for coming here this afternoon and enlightening us. So, Dr. Sudhir Parakh.
His advocacy and diplomacy when they will be in Delhi, I think excellent ideas. And whatever API is doing here, all are the great ideas. So this thing really will teach the young generation state-of-art education from the Western countries.
All right. Hi, everybody. Thank you all for coming, especially all my media friends. And just for those of you who doesn't know me, my name is Dr. Hetal Gaur. I'm a board-certified practicing OBGYN in New Jersey, and I am Board of Trustees of AAPI. This is my second year. And this wonderful idea of meeting with our press came after some discussions with Dr. Katula, our president, and Sunil Hali. And we decided that we should do this kind of communication between AAPI and media, because so many good things AAPI as a physician organization we do, and we sometimes don't kind of put those things in media, and we don't realize how much power media has and how many things can be lost in translation. And by media being on as our partner, not only they will spread our message across and reach to general population, right? Because we as a physician, we have a limited number of people that we see in our office, and we can impact them through our practice and our clinical knowledge through hospitals. But media has much wider range of viewership, or of newspaper readers, radio listeners, and we want to partner with them and get our message across and also learn from them, right? Today's idea is not only to tell about Dr. Katula's vision and what we have done and what we are planning to do, but also learn from our media partners what we should be doing, right? Because they are in touch with population, right? They hear from people. They go to many events. They go to different kind of events, and they meet all different kinds of people, and they hear from rest of the world what we as a doctors are doing good and not doing good. So we want to learn from them and what they hear, and how we as a API, we as a physician, because as our beloved Prime Minister said, everywhere he goes in the world, everywhere they say Indian physician, Indian IT people, and we are like a pride of our nation, and we have that responsibility that we should do it well. And as Satish mentioned, that we have been doing some projects here, like we have clinics, some charity clinics that has been going in United States that a lot of people were not aware through API. And now we are going to be doing these 3 projects. And he kind of didn't mention his 3 do's and 3 don'ts, because he goes by threes right now. So can you start that? Can you?
Of course. So this is a paper I presented when I did this Harvard course recently. So I summed it up into 6 things: stop 3, start 3, which are lifestyle modifications basically. Stop 3 is stop smoking, stop alcohol, stop eating processed meat or processed food in general. Start 3, start physical activity, start screening for cancers and vaccinations, especially in India, because HPV and hepatitis B virus vaccines can actually decrease the chance of some cancers actually. So that's what we want to do. Stop 3 and start 3. That's my slogan nowadays. So
I want to thank Satish to you for bringing this thing over here as a press conference, and thank you for inviting me over here. One of the things which I wanted to bring to your attention and Satish's attention is during COVID time, we started with teleconsultation regarding the aspect of COVID and everything. And I think there is a big demand for those things. If we can create some kiosk in India and have some time from the people who are voluntary here to continue that, that would be a great service to people from India, from the rural areas, as well as other things. So whosoever is in the think tank, I think should think about those things to create some kiosk, or kiosk costs somewhere around about $10,000 in India or something to create. People or patients can come over there, and if we give them a time according to our time here, many of our retired, experienced physicians can be manning those things during that time. So this is just a suggestion and a comment.
And there are a lot of good people out there who are actually doing the screenings. I met Dr. Kundaria yesterday, and he helped 4,500 people get HPV vaccination, each costing 1,500 rupees. His foundation pays for it, and he is planning to actually vaccinate thousands of people. So there are good people out there who are doing great work, and it's a great opportunity to collaborate people like that.
I was curious to get a little bit more history of API and how you're making the transition from supporting only physicians here to broadening it to also helping India more. And when did that transition really start, and where you headed with that vision? Thank you.
So actually helping India is not new. It's been going on for decades. API has charitable foundation, that's another arm of API. And they've been doing charitable clinics in India. It used to be like 17 or 18. They would see hundreds of thousands of patients every year. That's been going on for 25, 30 years or so, nothing new. But these programs, we always do global health summits, and I've been going to global health summits for the last 12 or 13 years. And I chaired oncology track for like 7 or 8 times. But each time what happens is when we go there, we do the summit and then we propose some changes and we come back. And we don't have proper follow-up. I mean, nothing to point fingers at somebody, but that's been, what is happening. But this year, what our vision is, not only just doing the summit, but how do we follow up? Because that's where we can make a difference. How can we make an impact? Not, mere, organization of a summit that may come in the media for a couple of days. That is not our goal. Our goal is to make some impact.
Thank you so much and we agree, and we know our negatives and our weaknesses and what we have done and what we have not done. So I think this is the first step in the right direction, and I hope the next leadership and everybody will continue. And I think Dr. Katsula has a very difficult task of budget and stuff. As some of you know, we have some financial and accounts and freezing of the accounts. But I think it's a great thing that we can suggest in the next governing body. And
Definitely. We will have some budget for media this year, I promise. Okay.
And you are right. We haven't, even though you guys have covered us time and time again, and we haven't been good to you guys. But this is the first step. And Sunil TriStar, to your thing, yes, we don't know our strength. And yes, we have let the organization go down from the glory days, as you said, that the president and the White House used to invite us and they listened to us. So we are hoping we can bring back the glory and work on it. And thank you for reminding us.